PCSK9 combines with the LDL receptors, and these receptors are internalized and degraded. So when we have the PCSK9 inhibitors, most of them are monoclonal antibodies. These antibodies inhibit these PCSK9 proteins. More LDL is available for internalizing LDL. More LDL receptors are present. So this also has been shown in two different trials, such as Farahe and Odyssey, to reduce the cardiovascular outcome. They can reduce LDL by up to 60%. So newer research is being done to developing monoclonal antibodies which have longer life, such as risankizumab, which was shown in REMAIN-2 trial to be effective for lowering LDL, and it can be given after every 3 months. So then there are certain novel strategies for PCSK9 inhibition. One of them is gene silencing. So gene silencing is a process where you do not interfere with the patient's own genome, but you give a certain genes, you can say mRNA, that stops the expression of that gene. So one such compound is inclisiran. So what inclisiran does is that this is basically a small interfering RNA. This RNA compound attaches to the PCSK9 mRNA and inhibits its function. So it temporarily inactivates the PCSK9 gene. So this compound can be given 6 monthly. Starting dose is 284 subcut on day 1, followed by day 90, and then 6 months thereafter. It can lower LDL by up to 50%. Orion was the trial that showed the benefit of this drug. So then another novel strategy is the total gene editing. So there are certain drugs such as the CRISPR-Cas9 system, which can produce permanent mutation in the genes. So this is the drug. Obviously, it's a prototype drug, not still available in the market or not shown to be that safe. The Verve 101 is the drug that basically permanently inactivates the PCSK9 gene expression. So Heart-1 is the ongoing trial, and this trial has shown that this drug can reduce cholesterol up to 69%. But obviously, by changing the genetic makeup, obviously there may be certain untoward effect. I will skip this Avanicumab and just jump up to my take-home messages. First of all, in this day and age, we have jumped up from LDL hypothesis, which was the hypothesis started in 1950s, 60s after Framingham heart trial, and now we have the LDL scientific theory. We know that LDL is bad. This is not a hypothesis. This is a principle. Secondly, LDL-based management requires not only the absolute reduction, but also the percentage reduction, which should be up to 50% in high-risk patients. Correct dosing of statin is a must. Prescribing low-dose statin, especially in older individual, basically is not giving full benefit of the guideline-directed medical treatment to your patient. So correct dosing is a must. Statin intolerance must be actively sought and managed, because otherwise patient usually stops taking statin and then usually comes back with the recurrent events. Finally, newer classes of cholesterol lowering drugs are going to change the landscape of cholesterol management in the near future. We are fast approaching towards a drug that can be given, that can be used with infrequent dosing, and that does not have muscle side effect. That drug Verve 101, which I discussed, that has once in a life dosing. So hopefully with this, we are going to better manage this patient. I thank you for your, I have extreme thanks to your patient listening, and I'm sorry for that little interruption we had because of net issue. Thank you. Any questions? And over to expert panel. Thank you.
Thank you very much, Dr. Ali. That was a fantastic presentation, given the difficulties especially. I would like to take this to the panel of experts, and I will begin by asking Professor Dr. General Sohail Aziz for his comments, please.
Thank you, Gurban Saab and Dr. Farahe. That's an excellent lecture. I think there's certain things which we need to understand, at least, which I tell my patients also, and that once you start statin, you must convince them that if you take it, you have to take it regularly. There's data that if you take it intermittently, it's actually harmful. And why that's harmful, that's another theory, and there's a concept to it. I will not go into it, but there's proper data that if you take it intermittently, it's going to cause more harm and more acute syndromes. So once you start it, you have to be committed to take it and don't change the doses unnecessarily. Number two, we talk about numbers, but we all see patients who had an acute coronary syndrome, and the LDL level was already pretty low, and they would say, "Well, my LDL is already very low, so why should I take statin?" Well, if your LDL was low, then where did you get your coronary heart disease from? So this number is not an asmani harf Allah Ta'ala ki taraf se कि that's the number you have. It's a racial difference, individual differences. So even if it's low, you have to bring it down to at least half of what it is. So that lower limit which you're talking about probably doesn't mention where the you started off. You just talk about the end point. So that also has to be taken into account. And I think there's data to suggest that even to bring the LDL below 40, there's further reduction. So, and since there's no downside which has been really reported, so one wonders how low is low. But I guess time will tell. Uh, and the other thing we don't talk about, I think bempedoic acid is much talked about and company wants to start, but it still has a defined role. If you can't reach a level with the two traditional combinations, then maybe you can add on to it. And of course, we should not talk about PCSK9. It is still a far-fetched thing for us, but there's certain other things we don't talk about to the patients, and we're all here for the patients, and that's not a doctor's fault. That I think we are blamed for a lot of things that for all the health issues, but I think medicine and these things are such a serious business. It can't be left to the doctors. The society has to take over. And for most of the ills in health are because of society issues. We don't talk about uh, diet. We don't talk about reduction in the carbs and the high index glycemic index foods. Now, I'm feeling that statin and these drugs should be given over the counter, and sugar and salt that should be given with the prescription. That's such a detrimental thing to it. Another thing which is so important is exercise. I mean, we all heard of Akshay Kumar, um, and he's a very uh, health conscious guy. And I was hearing his interview, and he said, if a guy cannot give 1 hour a day for his health and exercise, he has no right to live a good life. So I think we have to talk about exercise, we have to talk about diet, and of course we've had a very detailed discussion on this. And all this data is European data, where the heart disease comes much later in life. They come in the 50s and 60s and 70s, and we come across them in much younger age. So clearly we're a different breed of animals. I mean, I give this example very often that how many blacks have you ever seen in a swimming Olympic lineup? None. And how many whites have you seen in a sprinter or boxing? None. So there's such a big difference in the sport with the racial difference. How can not be a difference in the cholesterol? Those are things. So I personally feel that we as a nation are not capable of collecting good data, and that's because we don't have dedicated people who collect data and who practice it successfully and who got auditing the doctors edited, and we have to believe what the Europeans saying, and have to believe that data, but the trends are the same. Lower the better, and you got to add on with diet. Thank you very much.
Thank you, sir. Thank you for your kind comments. I would like to ask Professor Dr. Hafizullah for his comments on today's session.
Thank you. I think it was an excellent talk. I think he had worked very hard and making up a very good lecture, which was interactive. So I think he got all his messages across. I have got one claim to make. The beautiful scenery behind Suhail Aziz, where is Bourbon Golf Club, and I had taken this picture myself. So, if you see the beauty behind Suhail, that is perhaps because of Dr. Hafizullah. 2 points.
That I give you, sir.
Bempedoic acid, I think, is a new kid in the ground in the market. We should take it seriously. We should experiment with it. Besides increase in